This news update is brought to you by...
Hi, I'm Red Plastic Bag. Anyone who knows me knows I don't like cold. Sunshine reigns in my country. I love it.
Catch the sun power.
This is the 7 a.m. Barbados Today update for Wednesday, April the 2nd, 2014. I'm Emmanuel Joseph. Good morning. The National Union of Public Workers declares its intention to write the Ministry of the Civil Service soon to try to settle problems surrounding the gratuity of retrenched employees with government's Beautification of Barbados Division. General Secretary of the NUPW, Dennis Clark, tells Barbados Today the state failed to explain the ramifications of the gratuity contract in the first place. Clark says it's an unresolved issue the NUPW has been trying to settle since the end of last year.
I'm sure if you had told them, well, look, that 20% gratuity is in lieu of pension, and to take it and invest it in a small pension plan, the workers would have done that. None of these things they did, because they do these things behind the union's back. You know, the ministers bring them in, and the poor workers are glad to have a job, and they don't know about their contractual rights. And the workers now from Beautification of Barbados, they are lamenting, and they're heaping coals and brimstone on top of the head of the union.
Two Colombians whose sentencing had been delayed on about 2 occasions on burglary charges are to be sentenced today in the District Magistrates Court. Santiago Prad Viada and David Mauricio Botero Montez are reappearing before Magistrate Ian Weeks this afternoon. After pleading guilty at an earlier hearing on the last occasion, the presiding officer informed the men he was not ready to make his ruling because a pre-sentencing report that should have been submitted then was not yet ready. The magistrate therefore ordered that they be kept on remand until today, when the report should be completed. That report would determine what type of sentencing the Colombians will get. They pleaded guilty to burglarizing a St. Thomas home on January 22nd.
There's regional and international news after this short break.
Hi, I'm Red Plastic Bag. Anyone who knows me knows I don't like cold. Sunshine reigns in my country. I love it.
Catch the sun power.
In regional news, the death of a British sailor found dead on a burnt-out life raft off St. Vincent is being treated as suspicious, and police are believed to be looking for his wife. The man's yacht was destroyed by fire in the Caribbean Sea. The sailor, named in reports as John Garner, 53, was discovered on the raft by the Coast Guard off St. Vincent on Wednesday afternoon. He is believed to have suffered injuries to his head and both legs and was taken to the island's Milton Cato Memorial Hospital, where he was pronounced dead. Internationally now, U.S. President Barack Obama says his embattled signature health care program is here to stay after more than 7 million Americans signed up. He told reporters the law, nicknamed Obamacare, represented progress and benefited the economy.
This law is doing what it's supposed to do. It's working. It's helping people from coast to coast. All of which makes the lengths to which critics have gone to scare people or undermine the law or try to repeal the law without offering any plausible alternatives so hard to understand. I got to admit, I don't get it. Why are folks working so hard for people not to have health insurance?
And that's been the 7 a.m. update. Join us again at noon. Until then, log on to www.barbadostoday.bb. Subscribe to our e-paper and like us on Facebook to get more news and sports. I'm Emmanuel Joseph. Stay tuned to Health Today, our new segment.
Health Today is brought to you by Caribbean Alliance Insurance, agent represented by BGI Insurance Limited.
Healthy because I deal with the doctor and the doctor is always tell you that you're healthy. But the main thing is just to get a lot of vitamin C in your body.
Yes, I'm healthy because I don't eat the chicken, the lamb, the pork, the goat, you know. I maintain.
This stuff is healthy stuff. I eat all this stuff here. String beans, sweet potatoes, this is the ground food. Get back to the ground. You understand me? The ground is the healthier food here for the nation. So you have to get the healthy food here for the nation.
What does it mean to be healthy? Is it a number on the scale, a blood pressure score, gene size, a body free of disease, or something else? According to the World Health Organization, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Dr. Colin Alert, who's been practicing medicine for more than 3 decades, agrees, and he tells Health Today, health is not simply feeling good. Rather, it's several important factors that make us who we are.
One of the first aspects of looking at health is screening for the healthy conditions, diabetes, high blood pressure, perhaps cholesterol in particular. The second aspect relates to the general outlook, if they look healthy. Then you ask questions like, are you losing weight? Do you exercise regularly? What is your diet like? Those are sort of the important milestones you go through with patients to work out what their life is like. Furthermore, since mental health is important, ask things like, are you sleeping well? What's happening in your relationships and so on. So there's sort of many milestones that one has to cover in working out if people are healthy.
With that definition in mind, I asked Dr. Alert for a checkup of our population. I got a sober diagnosis. We are more unhealthy than we think.
We're heavily being battered by the chronic illnesses, hypertension, diabetes, which affect large numbers of our population to the point where that they are leading causes of death, they're leading causes of people ending up in hospital, they're leading causes of sick leave, they're leading causes of people going to the doctor, and they're preventable. And having said that, because we're not actively, from a public health point of view, working towards preventing them, it's distressing.
Even more worrying is the fact that we're slowly killing ourselves by our choices.
We've become lazy, for one, and we eat too much, we become licorice. And those primarily are the reasons why, compared to generations past, we are as unhealthy as we are.
Dr. Alert says the problem is massive and is treated far too lightly. In fact, he revealed that even at the point of diagnosis, many Barbadians are not making the right changes. He's even more concerned that the unhealthy practices of adults are being passed down to children.
We certainly have research here in secondary schools, in the primary schools, of the number of kids that are obese. So perhaps even at this point, we're a little bit behind the ball game, but we have to get to them. We have to sort of limit their access to fast foods. We have to limit and encourage them to exercise more. That's the bottom line problem. We have to get to them before they develop the illnesses.
Still, he says it's not too late to turn around what he calls an epidemic of unhealthy living. Dr. Alert suggests this will require all hands on deck, and the focus must be on preventative care.
So needs to be a coming together at a family level, at a community level, towards doing the healthy things.
Take a look at today's healthy checklist.
Eat a balanced diet. Get active and stay active. Keep your weight in good range. Get adequate sleep. Spend time with your family and friends. Nurture your spirit. Get regular checkup.
Be sure to join us next Wednesday when we take a look at today's healthy woman.